Thank you, Chairman. First question is going to be about the public option idea. Years ago, Senator Brown and I drafted the original public option that we tried very hard to get into the Affordable Care Act, and when we did so, there was a landscape of Americans who had no health insurance. The ACA has been a huge success. It has rolled out effectively in almost all places, and it has changed the landscape of who can't get affordable health insurance. What's the population, Mr. Asasi, and then Ms. Bloomberg, what's the population that you think, as we're designing a public option here in the Finance Committee, we should make sure we're attending to?
So from my perspective, I think that there's a few groups. The first, of course, are folks who are, for example, self-employed, owning their own small businesses, who simply can't get access to high-quality, affordable health insurance.
Even through the exchanges?
Well, in some cases, depending on where they live, they may or may not have access to high-quality insurance. And let me just point out, and you know this given your role as insurance commissioner in Rhode Island, one of the most important things about public options, it finally allows the government to get in there and demand a fair price. It addressed the pricing crisis that we're in. Right?
Ben Franklin, in his almanac years ago, said the best way to show that one stick is crooked is to lay a straight stick next to it.
Beautifully said.
And we rather hope that the public option would be the straight stick.
That's right. That's right.
And where should it be offered? Should it be offered through Medicare? Should it be offered through exchanges? How would you think it should be administered?
Well, the honest answer to that question is how can we get it through the Senate and through the Congress and have it enacted? That's the most important thing. But the bottom line is it has to have several dimensions. The first is it's available to everyone. The second is that it actually provides affordable, high-quality insurance that provides financial security. And that has to do with prices. As you said, the stick right now in America is incredibly crooked, right? And then the third piece is that the coverage has to be available in all kinds of communities, rural communities, urban communities, communities that have highly consolidated markets, communities that have more competition.
Ms. Bloomberg, anything to add to that?
Sure. By our analysis, Senator, the places where the public option would have the greatest impact are in those areas that have either few insurers offering coverage in the area or have very highly consolidated providers, so that the prices for obtaining care are higher, and as a consequence, premiums are higher. So those areas are often in areas that are not big population centers, but not always. So looking at where the prices are highest and where this competition, both in insurer and provider markets, is below expectations and below where we see it in other areas, are really the prime areas where the public option would have the greatest impact. You
Thanks.
could put it nationally.
Let me ask Ms. Collins. In Rhode Island, we have had two experiences. One was a health insurance commissioner who required insurers to focus on primary care first, and that drove the market towards primary care being the center point for service as opposed to people hopping from specialist to specialist. And the second has been the accountable care organizations that have really done stunningly well in Rhode Island. They've been national champs. One is Coastal Medical, a primary care practice in Rhode Island. The other is gathered together as the Integra program, it's called, with Rhode Island primary care physicians. And both of them have proven that significant savings in cost per patient can be achieved by improvements in care that lead to better health outcomes for those same patients. And that's always been the sweet spot that we've tried to hit. The Obama so-called triple aim was focused in that space. What should we be looking at now to try to maximize these proven, cost-reducing, quality-improving, better outcomes for Americans strategies? Thank you, Senator. I think what you highlight is the innovation that's happening in states on this issue across the country. Rhode Island is a standout. The other thing that Rhode Island has done too is empower their insurance commissioner to review rates and premium rates and also review hospital rates. So just taking an active stance on this pricing problem that I highlighted in my testimony and that's come up repeatedly in the hearing today.
But we're also seeing lots of activity in a lot of states. So I think it's an indication of what we can learn from what states are experimenting with. Washington State on the public option, Montana, I'm looking at changes to their employee benefit, state employee benefit program on hospital pricing. So it's I think Rhode Island is a leader, and there are a lot of other states that are innovating in this space very creatively.
Thanks. I'll just close with a comment, if I may, Madam Chair, which is that once you free up doctors from having to march to the fee-for-service treadmill and give them the ability to adapt the way they treat patients to a patient-first way of dealing with the patients, you then open up this arena in which all three of those things happen at once. Patients are happier and healthier, costs go down, and everybody wins. So we need to continue to work on that. And I would note that in the quarrels about the Affordable Care Act, there have been no quarrels about these provisions. Nobody's against accountable care organizations. They're across the states. They're doing really well, and we can make a lot of progress. So thank you.